Hello, hello. What's up, everybody? I am so excited to be recording this video for you. This is going to be my first reaction video to a different content creator who provides wonderful information, helpful information about mental health symptoms and ways to apply certain interventions to improve one's level of functioning, in addition to providing information about various mental health symptoms or emotional well-being concerns, and giving viewers advice as to when it would be a helpful time for them to seek additional consultation, and potentially getting what I would consider that folks in the mental health field would consider a therapeutic level of intervention. It has been a very long time since I've made a video. And of course, as years go on, things undoubtedly change. And so I will look forward to creating a video that gives updates. For example, I introduced myself as Dr. Vina Wilson, and during the last time that I created a video, I was not a doctor. So really, really proud of that accomplishment, and we'll share more in the future. For today, I am going to be reacting to a video by Dr. Tracy Marks, who is a psychiatrist that provides support in the ways that I named at the beginning of this video. The video that I'm reacting to is entitled "The Hidden Dangers of the Night: Youth Suicide." So in Dr. Tracy Marks' video, she identifies information about sleep cycles. She gives viewers suggestions on ways to utilize dialectical behavior therapy strategies that could be helpful in decreasing one's experience of ruminating unpleasant thoughts that could then lead to an individual having thoughts of dying by suicide, and also potentially ending their life related to the thoughts that they're having. I am going to provide some additional things to hold in mind, being that I am a therapist who provides dialectical behavior therapy as an intervention to adults and adolescents, and just kind of like offer considerations for you as the viewer to hold in mind as Dr. Marks gives guidance on utilizing these approaches, and just kind of like giving some fine tuning in areas that could be of additional support to you if you choose to take this on. Something that I would like for you to do, and that I'll be mindful to mention at the end of the broadcast here, is to leave comments, ask questions. I am someone who would be more than happy to answer the questions that you may have that will help you get to the destination that you want to be in. And also, if I don't know the answer, I will let you know I don't know the answer and do my best to point you in the direction of which you can then get the answer that you're looking for. Additionally, if you have ideas about topics that you would like for me to cover or react to, please drop that in the comments as well. I look forward to hearing from you. So with that, let's get into today's video.
Tracy Marks, a psychiatrist, and I make mental health education videos. Research recently presented at the Sleep 2023 conference showed that young people were more likely to experience suicidal thoughts and even attempt suicide in the evening and night. Why does this happen? Here's a few possible reasons. Probably the two most influential reasons are having a disrupted circadian rhythm and having reduced distractions in the evening. Your circadian rhythm regulates your sleep-wake cycle, and it also affects your mood and behavior. We see disruptions in this rhythm in the mood disorders like major depression and bipolar disorder, where people in a depressive episode can sleep 10 or 12 hours, and people in a manic episode can have trouble sleeping more than a few hours, or have completely reversed day-night sleep patterns, being awake all night and then sleeping during the day. It's very common for teenagers to have a body clock that's longer than 24 hours, making them lean more in the direction of night owls and have trouble falling asleep before midnight. Many teens grow out of this pattern, but some don't. Then if you add ADHD on top of the problem, it's even more pronounced and persistent. Then you add on the fact that nighttime tends to be unstructured compared to the daytime. At nighttime, we're alone with our thoughts, and the lack of distractions combined with the quiet of the night can amplify self-critical ruminations and negative self-talk. Then another factor that may have less impact, but still some, is worry about the next day. The anxiety that this creates can be huge for teens and people with social anxiety. The worry can lead to dread and then to hopelessness. Another concerning finding related to youth and suicide comes from research out of Johns Hopkins that was presented at the American Psychiatric Association in 2023 at the annual meeting. Their study showed that youth who commit suicide using firearms often used family-owned guns. When the researchers interviewed the family members, many of them saw gun ownership as important to their identity and freedom and did not see it as a danger to have in their home. Gun ownership is very...
So I want to jump in there. So something that I want to highlight is with my history of being a clinician and also having served for a short period of time as a chairperson for the American Foundation of Suicide Prevention, the Nevada chapter, gun safety is super important. Research shows that when somebody attempts to die by suicide, that particular mean, that use of a method to take one's life, such as a gun, can be, if there's access to it, that could lead to increased lethality, right? Like the higher likelihood of someone dying by suicide is connected to the ease of access to the item that they could use to take their life. So with that, something that I wanted to note is for those of you who have a weapon, no judgment from me, you have a gun, no judgment. It is super important that you have a gun lock or a gun safe. And if I'm not mistaken, I believe that they're at different gun stores. If you go and ask for a gun lock, they may be pretty inexpensive. And also there are some occasions where if you go to they have these gun shows, and they oftentimes will have people from different organizations who gives away gun locks for free. So that particular intervention in terms of reducing access to means as it relates to a gun, there are a number of simple ways to create a barrier between access and someone dying by suicide. Having reduce access to a particular item like a gun, reducing that access can help tremendously in someone not taking their life. So I wanted to name that.
Very personal and political. But from a clinical perspective, people who struggle with mental issues should not have loaded firearms in their home. Having suicidal thoughts is a huge predictor of suicidal behavior. Some people think about it, but never act on it. But the people who act on it don't always warn you that that's what they're thinking about. Given the pattern of increased suicidal thoughts at night, your loved ones can look okay in the afternoon, but then be flooded with these negative thoughts in the evening that they eventually succumb to if they have easy access to something like a firearm. So understanding the problem is just the beginning. How can we reduce this nighttime mental distress? You can start with strategies that help keep your circadian rhythm aligned to a 24-hour day-night cycle. A couple of things that help with this are maintaining a consistent bedtime routine and minimizing your exposure to blue light in the evenings. You get blue light from devices like phones and tablets, but also household fluorescent and LED lights emit a small amount of blue light. So even if your device has a night mode to reduce the blue light, having a lot of lights turned on in your home in the evening can still expose you to enough blue light to delay your nighttime melatonin release. Melatonin is the hormone that is released from your brain that signals to the rest of your body that it's nighttime and time to get ready to go to sleep. You probably can't walk around your home in the dark, so an easier way to deal with the various light sources is to wear blue light blocking glasses 2 hours before your bedtime. When you put these glasses on, it's as if you're walking around in darkness because your eyes and your brain see the absence of blue light to mean that your environment is dark. It's really a nice workaround. Usually the lenses have an orange or amber tint that absorbs the blue light. This is just one step to set the foundation for improving your sleep and therefore decreasing your vulnerability to the nighttime rumination. Another thing you can do is develop a soothing bedtime ritual to reduce distress. And this could be things like reading before bed, spending time with a loved one, and doing things that you enjoy before bed. These pleasant activities create a sense of safety and grounding. Now, these things may not...
Okay, so regarding the piece that Dr. Marks named about improving your sleep hygiene, what we would consider sleep hygiene, to help balance out the circadian rhythm, I wanted to just kind of jump in there. So research will show that if one has too much sleep or not enough sleep, or their quality of sleep is quote unquote poor, that can increase the vulnerability of someone being more emotionally reactive and vulnerable to stressors that happen in life. Additionally, it can also impact the lack of sleep, or too much sleep, or poor quality sleep can affect one's ability to have access to thinking in a more rational, even keeled kind of way. So, and then also, poor sleep, for whatever reason, can then increase the likelihood of someone experiencing a mood disorder, or one being in place for a lengthier amount of time. And so something that I would encourage you all to look into, whether it's you that is impacted by poor sleep or someone you know who's impacted by poor sleep, please go online, do a quick Google search or any search engine that you like, and look up the phrase sleep hygiene protocol. There are so many resources out there that gives people clear direction as to how they can improve their sleep hygiene, which shows or proves that it helps with mood regulation, emotional regulation, and an easier access to thinking in a even killed kind of way. So wanted to name that.
Keep your thoughts away. Dialectical behavior therapy was originally designed to treat borderline personality disorder, but it's not limited to that disorder. DBT offers a comprehensive range of coping strategies under its distress tolerance module. These skills are designed to help you navigate through and withstand crisis situations without making them worse. Here are some distress tolerance skills that can be particularly helpful for the evening distress. The first one is TIP skills. T stands for temperature. Changing your body temperature can rapidly alter your mood. For example, splashing your face with cold water or taking a cold shower can help reduce anxiety by activating your vagus nerve. The vagus nerve is the brake pedal that has the opposite effect of adrenaline. Taking a warm bath is another way to change your body temperature. I stands for intense.
Okay, so with tip skill, right? So with tip skill, after each one, I'm probably just going to add information along the way. The T in the tip skill, temperature. Dr. Marks, in my opinion, is doing a fantastic job in laying out strategies to employ to aid in decreasing vulnerability for someone to have like thoughts of dying by suicide, and ways to intervene between the emotion or the thought and the urge to take one's life. So fantastic job. Wanted to name that. With regards to temperature, the reason why the temperature piece works, with emphasis on it being cold water, or a bowl filled with ice water, or an ice pack over one's forehead, like third eye area across the eye sort of thing, it helps with tipping your physiological response. So if I would imagine that if someone is experiencing like a crisis, lots of ruminating thoughts, that thoughts are racing, heartbeat is accelerated, blood pressure is elevated. And so in using what the temperature piece, what you end up doing is reducing your blood pressure, slowing down your heart rate, and helping with averting the crisis from heightening in that moment. There's something to hold in mind though. If you're going to use temperature, if you already have a lower heart rate at baseline, if you have, and that could be due to medications that you're taking, it could be due to whatever genetic factors in place, or if you have an eating disorder, check with your healthcare provider before you employ that particular method, because it could reduce your heart rate in a significant way and cause, have an impact that would be unfavorable, right? Undesirable. Additionally, Dr. Marks did name that a warm bath could be helpful, and that's not quite temperature as it relates to the dialectical behavior therapy framework. my understanding of that particular piece is that it would be important that it is cold water, because it is more impactful with reducing those things that I had named a moment ago. So a warm bath could be really nice. That would be more of like a self-soothe approach. And also, if you're in the moment of a crisis and having crisis thoughts, really intense rumination, thinking about taking your life, I would offer that it would be most effective for you to use something cold for 30 seconds to help with decreasing the intensity of the physiological responses that you're having. Additionally, if you choose to use an ice pack to cover like your third eye, over your eyes, that kind of thing, if you do so, place it over your forehead, bend at the waist, and hold your breath for like 15 to 20 seconds, right? I would even say 30. And also, if you can't hold your breath for that long, try for at least 15 seconds while bending over at the waist, noticing the coolness over your forehead, and then come back up and see if the intensity of your anxiety has reduced. I'm not saying that this is going to be relaxing. That is not what this is designed for. It is to help with decreasing your physiological intensity. So then that way you can potentially layer on other skills to help with decreasing the intensity that you're experiencing in that moment.
Exercise. Engaging in brief, intense physical activity can help release built-up stress and tension. This could be as simple as doing a set of push-ups, jumping jacks, or going for a brisk walk if it's not too late in the evening. P stands for paced breathing. Slowing down your breathing helps calm the nervous system, also through activating your vagus nerve. There are lots of ways you can control your breathing. Taking deep, controlled breaths from your abdomen and then exhaling is one pattern. The other P stands for paired.
Okay, intense exercise. So intense exercise is super helpful with shifting the intensity, like the adrenaline that you're having, the ruminating thoughts that you're experiencing, the agitation that you're having, potentially anger that you're experiencing, secondary to whatever the quality of your thoughts are. Intense exercise is super helpful with redirecting that energy. And research also finds that when we exercise, we have an improvement in our mood and our emotional well-being. So intense exercise when you're in a state of crisis is helpful if you do it for at least 20 minutes. Again, cautionary thing to hold in mind. If you are someone who has an eating disorder like anorexia, as an example, or any other eating disorder that has been diagnosed, check in with your healthcare provider to see if that is the most effective intervention for you, because that could have detriments if you are someone who tends to over-exercise, are undernourished, X, Y, and Z. Incorporating intensive exercise could cause some harm. So be mindful of that. And in regards to the paced breathing, slowing your breathing down is effective in reducing emotional arousal, because it activates the parasympathetic system to help bring relief and relaxation. On to paired muscle relaxation.
Muscle relaxation. This involves tensing and then relaxing different muscle groups in the body. This is also called progressive muscle relaxation. To help keep up with the muscle groups, you can start from your head and then work your way down to your feet, or move upward, go in the opposite direction. This exercise relaxes your body and can also be a mindful exercise as you turn your attention away from what's going on in the room or in your life and focus on the muscle groups and how it feels to tense and relax them. How do you actually implement this? The idea is that you go through all of the tip steps. Depending on how long you spend on the temperature step, it should take no more than 30 minutes. And this may seem like a lot of things to do, but the time is going to pass no matter what you're doing. So you can spend it ruminating, or you can spend it actively engaged in activities that distract your thoughts and physically relax your body. Let me give you one more distress tolerance skill, and that's the wise mind.
In regards to the paired muscle relaxation, that is simply you tensing up whatever part of your body that you're focused on. And then when you are relaxing, saying to yourself the word relax. So you can like tense your shoulders up and then say to yourself, relax. Pushing your shoulders back, noticing the tension, and then saying to yourself, relax. So it can be any part of your body that you would like. There are different progressive muscle relaxation exercises that you can research, or you can look up paired muscle relaxation in case you are needing some inspiration as to what muscle groups to target. There's really no best muscle group to target, just a helpful intervention.
Accepts. Wise mind is a concept from DBT that represents the intersection between our emotional mind and our reasonable or logical mind. Your emotional mind is when you're ruled by feelings, emotions, and moods, and potentially impulsive actions. Decisions made from the emotional mind might lack foresight and logical grounding. Then you have your reasonable or logical mind. This is when decisions are based solely on facts, logic, and reason without taking emotions into account. And while these decisions are well informed, they might lack emotional insight or understanding. The wise mind represents the balance or integration of the emotional and reasonable minds. It's the place where logical thinking and emotional experiences come together, allowing you to make decisions that honor your feelings and represent the facts. So with Wise Minds Accepts exercise, you tap into your wise mind while engaging in these activities. These activities are designed to distract you from your distressing thoughts. Here's the Accepts exercise. A stands for activities. Engage in a hobby or activity that captures your attention, like drawing, playing music, or crafting. C stands for contributing. With this, you're doing something kind for others, like writing someone a note or doing a small chore for a family member. The other C stands for comparisons. This is where you widen your perspective on things. Compare your situation to someone who may be experiencing a similar challenge. Are there things that they had to deal with that you didn't? You can use anything that's bothering you and think about how someone else may be dealing with the same thing, but not have the same resources that you have. E stands.
Let me pause there. Okay, so as I mentioned, I work with teenagers, and I've had a couple of teenagers. One pops into my mind who has said that using that particular approach from Accepts, the comparisons, that it felt wrong. Because they were thinking about if someone had it worse than them, that wouldn't actually bring them comfort, that would bring them suffering and feeling like, this self-invalidation piece, like how dare I feel this emotional pain or this psychological pain in light of me being aware that there's someone who has it worse than me. Like that doesn't make me feel good. So if you're someone who resonates with that particular teenager's point of view, as well as other teenagers who have said that to me, then something that you can do if you want to practice comparison would be to compare what you're going through in that moment that you're in with a moment that was more difficult for you in the past, with the awareness of you made it through that previously more difficult moment, and that it will happen again in light of the evidence that you have from the past. So this present unpleasant experience, painful experience, knowing that you will get through it because you got through the ones in the past, could help with tolerating the distress associated with whatever it is that you're thinking about in that moment.
For emotions. You want to invoke the opposite emotion to what you're experiencing, like watch a funny movie or listen to uplifting music to counteract the negative feelings. P stands for pushing away. You create an image in your mind to leave the distressing situation. Visualize a protective wall between yourself and the source of distress. T stands for thoughts. Focus your mind on something other than what's distressing. This could be counting, doing puzzles, or reading. S stands for sensations. Use your senses to distract you, like holding onto an ice cube, snapping a rubber band lightly on your wrist, or chewing something that has a strong flavor. DBT has a lot of useful skills to manage distressing thoughts and emotions. If you still struggle with suicidal thoughts or negative self-talk, even after trying these, you may need to seek the help of a professional, such as a therapist or psychiatrist, depending on the severity of your emotions.
All right. That was Dr. Tracy Marks. I think that she did a fantastic job at laying out some strategies that could be helpful if you are a teenager or even an adult, I would say, who at night experiences sleep disruption, who may have thoughts of dying by suicide, like kind of how to interrupt the thoughts and the emotions that are created out of the pain that you're experiencing, like how to interrupt those things and help with creating a barrier between that experience and you dying by suicide. I can't emphasize this point enough that Dr. Marks highlighted. If you are having this experience and you're trying out these strategies, right, and like it's not quite as helpful as it is designed to be, please go to a mental health provider who can best assist you, because maybe they can, not maybe, they will be able to tailor a set of interventions that would be designed for your specific needs that will be most helpful for you. While the strategies highlighted in this particular video, as you know, presented by Dr. Tracy Marks and reacted to by me, are helpful, there could be something that's even more beneficial to you for your specific needs that would require the assessment and intervention from a trained, licensed mental health provider. I appreciate you all for hanging out with me and watching this video. As I had mentioned at the top, if you have any questions about this particular, these suggestions, please leave comments in the comment area. And also, if you have any topics that you are interested in that you would like for me to react to, please let me know, and I will do my due diligence in finding a video that I can react to and share my point of view in case it's helpful. Until next time, peace.